You know, we've all been there. You get a cut, a scrape, maybe a little nick while you're shaving, and after a few moments, the bleeding just stops. But have you ever really thought about what's going on inside your body in those few minutes? Well, in this explainer, we're going to dive into the incredible, high-stakes process that literally keeps you from bleeding out.
It seems like such a simple question, right? But the answer? Oh, it's this amazing, microscopic ballet of chemistry and mechanics. Your body has this built-in, lightning-fast system designed to plug leaks and fix damage on the fly. And today, we're going to see exactly how it pulls it off.
So, the fancy scientific name for all this is hemostasis. It's pretty straightforward, actually. Hemo means blood, and stasis means to stop, so literally stopping the blood. The best way to think about it is like your body has its very own microscopic emergency response team, just waiting to spring into action.
And this team follows a super specific 5-step plan. First, there's the first alarm, or a vascular spasm. Then the first responders show up to make a platelet plug. After that, the reinforcements arrive for coagulation. Then you've got the repair crew for clot retraction. And finally, the cleanup crew for fibrinolysis. But you know, before we get into how clots form, we've got to ask, why isn't our blood just clotting all the time? Okay, so first things first, let's talk about how blood normally flows. Your body has this really sophisticated anti-clotting system that's always running in the background. And understanding this is absolutely key to getting what happens when things go wrong and you get an injury. So your blood vessels are always, and I mean always, working to keep things moving smoothly. The cells lining them are constantly releasing chemicals like nitric oxide, which basically act like a force field, repelling platelets. At the same time, you've got these little proteins on patrol, neutralizing any stray clotting factors that might be floating around. There's even a whole deactivation system to shut down key clotting proteins before they can even think about causing trouble. This is the body's default setting: prevent, prevent, prevent.
All right, now that we know the default state, let's talk about what happens when there's a breach. We're on to step 1 of hemostasis, the first alarm, also known as a vascular spasm.
And this first step is absolutely crucial. Before any cells even get to the scene, the blood vessel itself goes into lockdown. It's called vasoconstriction. The vessel literally narrows itself to instantly cut down the blood flow to the damaged area. It's kind of like pinching a leaky garden hose to slow down the water while you run to get the tape. This lockdown gets triggered in 3 different ways, all at the same time. First, the damaged cells scream for help by releasing a chemical alarm called endothelin. Second, the physical damage itself makes the muscle just contract automatically. And third, your pain receptors fire off a nerve reflex that tells the vessel to squeeze shut. It's a triple threat system, super redundant and incredibly effective. Okay, alarm sounded, vessel is constricting. Now it's time for step 2. Forming the platelet plug. This is when the first responders of our little emergency team finally arrive on the scene. And this whole thing happens in 3 quick stages. First, adhesion. When a blood vessel gets cut, the collagen underneath is exposed. Platelets see that collagen and they stick to it immediately. This makes them activate. They literally change shape and start releasing chemical signals. Think of these signals like a siren, calling in all the other nearby platelets to come pile on and form a temporary plug. And how they connect is super specific. It's not just a random pileup. They use one kind of receptor to stick to the vessel wall and a completely different one to stick to each other. And this little detail is hugely important in medicine because these receptors are the exact targets for some major anti-clotting drugs. So at this point, we've got a temporary patch. It's done a pretty good job slowing the leak, but it's not very strong. It's kind of flimsy. One strong surge of blood could just wash it all away. This plug needs to be reinforced. It needs to be made into something much, much stronger. And that brings us to the most complex and honestly the most powerful part of the whole process, the coagulation cascade. This is a crazy chain reaction of proteins, what we call clotting factors, that are about to build a seriously strong and stable scaffold to lock that platelet plug in place. Okay, so this whole cascade gets kicked off by 2 different paths that eventually merge into one. You've got the intrinsic pathway, which is triggered by stuff already inside the blood, like if it touches a weird surface. This one's a little slower. Then there's the extrinsic pathway. This one's triggered by major tissue damage outside the vessel, and it is blazing fast. We're talking like 30 seconds. But no matter which path starts it, they both have the exact same goal: to fire up the common pathway. Now, I know this cascade can look super intimidating with all those numbered factors, but trust me, there's a pretty easy way to remember the basics.
For the intrinsic pathway, just count down from 12 but skip 10. So it's 12, then 11, then 9, then 8. For the extrinsic pathway, just think 3 plus 7 equals 10. See? Both roads lead to factor 10, which starts the common pathway. So you can just remember, X marks the spot.
The whole point of this entire cascade, the grand finale, is to create something called a fibrin mesh. The last activated factor, thrombin, goes to work on a protein floating around in your blood called fibrinogen. It converts it from a soluble thing into these tough, insoluble strands of fibrin. These strands form a web, a net that weaves all through the platelet plug. It's like biological rebar, locking everything down and creating a truly stable, solid clot.
And there we have it. The leak is sealed. The bleeding has stopped. The area is secure. The emergency is basically over. But the body's job isn't quite done yet. Now it's time to move on to the repair and cleanup phase.
All right, finally we get to the repair and reset phase. This is where the cleanup crew comes in. And their job isn't just to repair the damage, they also have to know exactly when it's time to safely get rid of the clot.
The clot itself basically turns into an active construction site. The platelets that are trapped inside it start to contract, and they physically pull the torn edges of the blood vessel closer together. While they're doing that, they're also releasing these powerful growth factors that are essentially screaming at the vessel wall, hey, time to rebuild your muscle and regrow your inner lining. So once the tissue underneath is all healed up, you don't need that clot anymore. Actually, leaving it there could be pretty dangerous. So the body kicks off a process called fibrinolysis. The healed vessel walls start releasing a substance called TPA. This TPA activates another protein called plasmin. And you can think of plasmin as a pair of molecular scissors that just go to work, methodically snipping apart that fibrin mesh, dissolving the clot, and getting blood flow back to normal.
So there you have it, a quick tour of your body's amazing internal emergency response system. But this isn't just some cool biology trivia. Understanding this process is absolutely fundamental to so much of modern medicine.
Yeah, the connections to medicine are so direct and powerful. That daily aspirin some people take, it works by making platelets less sticky. The clot buster drug they give you during a stroke, that is literally the TPA we were just talking about, used to dissolve a dangerous clot in the brain. Ever heard of a D-dimer test? It looks for the little fibrin fragments left over after plasmin has done its job, which can tell doctors if there's a clot. And of course, drugs like heparin and warfarin are designed to interfere directly with the coagulation cascade.
So from a tiny paper cut all the way to life-saving medical treatments, hemostasis is this incredibly elegant and vital process. It's powerful enough to stop a major bleed, but it's also precise enough to know when the job is done and it's time to clean up after itself. But you have to realize this entire system is a constant, delicate balancing act. If it doesn't clot enough, you get diseases like hemophilia. If it clots too much, you get dangerous things like thrombosis, heart attacks, and strokes. Which really makes you wonder, what happens when this perfectly balanced system gets it wrong?